right, so good morning, everyone. Good morning, good morning. So welcome to our webinar in recognition of Menstrual Hygiene Day, which is actually next week on the 28th of May, but we decided to have our event a little early. So I guess we're one of the first, I don't know, maybe one of the first to host a menstrual hygiene day webinar this year. So welcome to the webinar anyway. So this year's theme for Menstrual Hygiene Day is Together for a Period-Friendly World. And really this theme highlights the critical importance of collaborating in creating an environment where menstruation is fully supported. So we're really happy to welcome you to this webinar today. And today we are really pleased we have organizations represented from across the region, but also across the globe, to talk to us a little bit about stigma and how we're aiming to address stigma around menstrual health issues. So just to show you what our agenda is looking like. So we are going to start off with a presentation by Kimberly Sanko-Panchal, and she is an MPH, a Master's in Public Health student at the University of Illinois in Chicago, and she's also interning at Lake Health and Wellbeing. So Kimberly will start off with a presentation and just give us a little bit of background. We'll then hear from Ina Herger from the WASH United, is the International Coordinator of Menstrual Hygiene Day, and she'll talk to us a little bit about some global perspectives on addressing stigma and challenges around menstrual health. We'll then hear a regional perspective from Mr. Linston Skerritt, who is the Adolescent Development Specialist at UNICEF. You'll then hear from myself, and I'll talk to you about a local perspective. So we'll talk about the project that we're implementing here in St. Kitts and Nevis. Then we'll hear from Saros Hendrickson, who's the Interim Director at the Department of Gender Affairs in Nevis. And Saros will give us a government perspective. And then we'll have a Q&A session, so you can ask all of your questions then. But feel free to put your questions in the chat throughout the session, and then we'll get to your question as and when it comes. Also, just a reminder to mute your mic so that we don't disrupt the session. And then we'll end up with some closing remarks from Kimberly. So really just want to say thank you so much for joining us today. Feel free to introduce yourselves in the chat and tell us who you are and where you're joining us from and your role or title or your job title. And we hope you enjoy the session today. Hopefully it should be a really interesting discussion on a topic that really tends to be overlooked. So we're really looking forward to this discussion. So without further ado, I am going to hand over to Kimberly Sanko-Panchal. As I said, she is a Master's in Public Health candidate in Global Health at the University of Illinois in Chicago, and she's currently serving as an intern with us here at Lake Health and Wellbeing. And she's going to talk to us a little bit about the stigma and challenges surrounding menstruation to give us a bit of an introduction. Over to you, Kimberly.
Thank you. I'll share my screen.
Okay.
Can everyone see my screen?
Yes, we can. We can.
Okay, hello everyone. Oh, what did I do? Hello, greetings and a warm welcome to all participants joining us for this vital discussion on breaking the silence surrounding period stigma. My name, as Abby mentioned, is Kimberly Sanko-Panchal. I hail from Belize, and I've been working as an intern with Abby at Lake Health and Wellbeing since the start of the spring semester. I'm a master's student with a global health concentration at the University of Chicago.
So go ahead, Kimberly. I'm going to mute the person's mic. Go ahead.
Okay, thank you. Today we will be talking about period stigma. To menstruate is completely natural, associated with normal female reproduction. However, it's surrounded with stigma, negative perceptions, and poor communication. When menstruation occurs, it is typically limited to its pain, physical and emotional stress, inconvenience, and embarrassment. With Menstrual Hygiene Day approaching May 28th, there is no better time to shine a light on period stigma. Menstrual Hygiene Day serves as a poignant reminder of our collective responsibility to challenge the status quo, to advocate for for inclusive policies and to foster environments where menstruation is embraced as a natural process. As we shed light on the impact of these societal constructs and how they have shaped the lives of women and girls, from cultural taboos to misinformation perpetuated by myths, the consequences are far-reaching, affecting not only physical health, but also mental well-being, education, and economic empowerment. In the Caribbean, as in many parts of the world, menstruation is shrouded in silence and shame. From whispered conversations to outright exclusion, misinformation, and misunderstanding, the stigma surrounding periods persists, depriving those who menstruate of dignity and basic rights. It's time to break the silence and dismantle the barriers that hinder progress towards menstrual equity. Throughout this webinar, we will explore the root causes of period stigma, dissect prevalent myths, more importantly, we will highlight actionable steps we can take individually and collectively and pave the way for a future where discussing periods is normal and done without fear or shame. Before we dive into my presentation, we'll start with a quick poll. Please take a moment to share your thoughts, and we'll revisit the results shortly. Period stigma, oh, sorry. Please continue while I continue with the presentation. Period stigma isn't just a localized issue. It's a global phenomena that knows no boundaries. Despite menstruation being a natural biological process, to this day, it continues to be stigmatized worldwide. From the Caribbean to every corner of the world, women and girls face barriers rooted in cultural norms, misinformation, and societal taboos that surround menstruation. A menstruating person has been treated as an unclean thing in many cultures. The cloths, pads, or tampons used to absorb menses are shunned. Even when new and unused, those products are taught to be hidden. Social norms decree that anything associated with menstrual blood is a matter of shame and embarrassment. Genuine menstrual issues and concerns are often passed over or ignored. These barriers not only hinder access to menstrual hygiene products and healthcare, but also perpetuate shame and silence, robbing individuals of understanding the process and knowledge about knowing that normal in terms of periods and bodies is different for everyone. Now let's pause for a moment to consider if period stigma myths and taboos impacted you or someone you know in any way. Please complete poll number 2. Menstruation is a natural biological process experienced by billions of people worldwide. On average, a girl begins to menstruate at 12 and will menstruate until she is 51. That means on average, she will menstruate for 40 years. She may have up to 480 periods in her lifetime. From cultural beliefs, the myths you see here that surround periods not only perpetuate stigma, but also contribute to misinformation and misunderstanding. When menstruating women and girls are represented as being emotionally unstable, irritable, irrational, and ill, period stigma can negatively impact women's and girls' physical and mental health. Shame prevents conversations about menstruation. In some communities, young girls know nothing about menstruation before they start their periods. This lack of communication inhibits the building of connections among other menstruators, prevents empathy, and prevents the building of resilience. Girls are advised, often by their own mothers, to be silent about their periods. And this may be intended to shield and protect their girls from boys or men. However, this limits the level of knowledge about periods among both menstruating girls and males in the community, and then reinforces the sense of embarrassment about menstruation. But why does addressing period stigma and debunking myths matter? It matters because the consequences of misinformation can be dire. From barriers to accessing menstrual products and healthcare to negative impacts on mental health and self-esteem. The repercussions of believing in period myths are far-reaching and multifaceted. Throughout this webinar, we'll challenge commonly held misconceptions. We'll unpack the social, cultural, and historical context that fuel these myths and explore strategies for combating period stigma in our community and beyond. Thank you for joining us on this important exploration of period stigma. Together, let's demystify menstruation and pave the way for a future where every individual can experience their periods with dignity, knowledge, and empowerment. And I will hand it back over to Abby.
Wonderful. Thank you so much, Kimberly, for just giving us a bit of a background and really setting the scene for us in terms of some of the challenges around period issues, the stigma, and some of the barriers. And so now, without further ado, I'm going to hand over to Ina Jerga from WASH United. Ina is the International Coordinator of World Menstrual Hygiene Day, and she has been that coordinator for over 10 years. So she has a lot of experience, not over 10 years, but 10 years. So she has a lot of experience. She's a leading international expert on menstrual health and hygiene, including advocacy and education on the topic for 14 years, and a development professional for 20 years. So over to you, Ina.
Yeah, thank you very much, Abby, for inviting me to speak in today's webinar. We do have a wonderful collaboration with Leg Health and Wellbeing around menstrual hygiene management education with girls, which is really impediment to break those type of stigmas and taboos and myths Kimberly was talking about at a very, very early age, especially at the onset of the first period, the menarche, where so many questions are arising for girls. And if there's no education, if girls don't have the right information, they really their first experience is often really a terrible, traumatizing one. And that continues, as Kimberly also said, until menopause, the right to information. Today we talk broadly about stigma and the lack of awareness. And I'm glad that the session was also framed to look at solutions. So how do we overcome these various myths and taboos and stigmas? My perspective will be a global one and a bit focused to the work that we do. And speakers after me will look at regional and local ones. So we're triggering down. So I only have a few minutes. So I want to be quick, and I prepared some slides for you to guide you through. So I just also wanted to emphasize that if there are stigmas and taboos and silence around the issue, no one dared to speak about the needs and challenges of themselves, but also of their friends and other people who menstruate. And without voicing challenges and needs, there will be no solution, there will be no policy change, etc. So it's really utmost to start the conversation, to talk about menstruation, normal, and break the stigma and taboos around it. And we're on a good way as we're already doing this. And good menstrual health and hygiene is not rocket science. There are good solutions around it, but the taboos, the silence, and the stigma around menstruation is often the biggest barrier that we need to face to interventions from a programmatic point of view, from policy change, but also in daily life. So one of the solution is Menstrual Hygiene Day. So let me explain a little bit how we got there. I'm just skipping one back. So WASH United worked on back in the early 2010 on another taboo subject that means lack of toilets and open defecation. And we did a big campaign in India around the issue, like a traveling carnival. And then we discovered that there is an even bigger taboo that is not talked about by governments and local people, and that was menstruation. And we were really challenged to use our approach of positive communication, of influencers and games and activities to tackle the taboos around menstruation. And then we thought, should we do another campaign? Should we do another carnival around menstruation? And at one point we thought about why not establishing a global international day around menstruation or menstrual hygiene. It didn't exist yet. There was no platform where everyone got together. So yeah, so why not establishing a global awareness day? And it is a perfect vehicle because it focuses the attention on the issue like a laser beam. It increases awareness, break the stigma, and it's creating action and advocacy. And it's also a key opportune moment for media influencers and governments who have so much on their plate. But if you have an awareness day, it's really a hook to get them on board. What I personally love are the last 2 points, is that it's a platform for everyone. So it's inclusive. It's not like you do a campaign and you bring in a few more people, but it's really everybody can celebrate Menstrual Hygiene Day with every means, being on the ground, digital, or through a webinar like this today. And it's also annually recurring, obviously. And that means whatever you do is, especially from a perspective of working with governments, you can continue the conversation and you can build up what you did. And why the 28th of May? You may ask, and it's very, very simple, because the 28 is the average duration of the menstrual cycle, and 5 is the average duration of the menstrual period. So 28/5, 28 May, Menstrual Hygiene Day, even rhymes, so the better. So the day was born. We didn't need permission from the UN or somebody else, so that was perfect. And as I mentioned, it's the key moment of attention, and this is data, how the social media is speaking about menstruation, menstrual health and hygiene throughout the year, and you can really see the big peak on that day globally. So it is this laser point focus I was talking about, and it did happen. And MH Day is used for different activities, and our more than 1,000 partners and many other individuals celebrated along what their resources and aims are. So ranging from education sessions with girls to fashion shows in Uganda, to meetings with politicians in Pakistan, and media in Fiji that reports back on the commitment by the minister. And on the top right, the most successful post that happened for MH Day was one of the Kardashians posted on MH Day a few years back. But even those big influencers know about the day and use it to promote the issue. We established a global symbol for menstruation, worn on MH Day, but every day as well, like the menstruation bracelet as well, 28 beads, 5 of them are red, and it's worn by young people, by team members, like here in the middle, where like the whole organization was posting pictures, or by politicians, like in the lady in the blue jacket is our Minister of Development Cooperation, who proudly wears the bracelet and posts it on social media. The impact has really grown, and last year reached 705 million people, just a net, it's like a really strong, like hardcore calculated reach that of million people that we reached, mostly like through online sources, and on the ground we reached many, many more. And I wanted to also share that MH Day is, the growth of MH Day is also symbolic of the growth of awareness around menstrual health and hygiene all year round. 10 years ago, there were like only a few development practitioners doing work around keeping girls in schools. And by now we have seen such a tremendous change in that. So yes, Menstrual Hygiene Day is the peak, but the overall traction on the issue is very, very similar. So I picked out some examples that some of you might be aware of. In the popular media, we've seen in 2050, they called it the year the periods went public, and Newsweek put it on a cover. There was a marathon. Period End of Sentence won an Oscar for Best Documentary. I think that was 2019 or 19. Let's Turn Red, a wonderful movie from this, like Pixar, came out last year. And even like an advertisement, the liquid changed from blue to red. We've seen many actions and policies, such around at the UN level, but also especially around period tax removals or reductions, and policies in several countries where they provide now free menstrual pads to girls in schools, university, and in other institutions. So progress has been also made throughout the year around that. So, oh, there's an A missing. I don't know where this dropped. So I just wanted to say, yes, MH Day is a great opportunity for advocacy on the day, but we need to be do advocacy all year round. And I have 3 points. One is that, oh, sorry, the animation is kind of screwed up. Anyway, so first, we have more research and data available, such as Kimberly was presenting and Kimberly was doing. So we have a joint monitoring report published by WHO, UNICEF soon on MH Day with data around MHM in schools. There is a funding tracker where we know what governments and donors invest in MHH. There are more partnerships and collaborations established. There's a global menstrual collective, but also global, regional, national coalitions and networks. Some are dedicated, for example, only to menstrual cups. Some on supplies, some are stakeholder networks. Some can be very loose networks to demand text change by local youth advocates. So it's a lot of things happen, and I believe in partnerships and collaborations. And last but not least, we need to take menstrual hygiene out of the silos. It is so important for gender equality as a whole, for education, for women's economic empowerment, for society's development, and building your social capital. So bringing the issue to global events or other opportunities, such as here, the largest gender equality conference last year, is so important to build, again, collaborations and make the case that it's so important. My 2 last slides. So I wanted to also highlight there are still global challenges around awareness and advocacy. So first is not all countries are on the equal level. So we need policies that bring in the education into schools, address period poverty through free products, and so on. So this is especially a call for your region, because there's a lot of progress in Asia, Africa, and India. So you can still do more. And policies and programs need funding. And we know that the investment into menstrual health and hygiene is not enough. So we are really committed to call for more investment, and please also help us to raise that awareness. And a last point that I find very sad is that we see a few countries getting more conservative through the recent election, and there's a big pushback towards gender equality. And as menstrual health and hygiene is so impediment to achieve gender equality, it's also at risk. So we can't let that drop. So we need to raise our voices because gender equality, for me at least, is the ultimate goal. For this year, the theme is Together for a Period-Friendly World. And I really love it because it shows the ultimate goal and that we're in this together. So MH Day is in a week. So if you want to participate, it's very easy, especially you just go online and take a picture with the menstruation bracelet as a digital form, or you use some of materials, you develop a blog. So there are multiple opportunities. Just go to our website, you find a lot of information. I think Aya can share the link to our website. But if just free ask to use if you post something, always use the hashtag Period-Friendly World and MH Day, because that means we're all together, we're all in one voice, and the rest is your own text and your own story. You have free campaign materials that you can profit from, and please do share your event images and reports from us, from your activities or whatever work you do throughout the year. We love to hear what's happening, and we love to feature also your region, because your voice matters too in the global dialogue. Thank you very much.
Oh, thank you so much, Ina, for your presentation. I really appreciate you telling us all about the work that you're doing with Menstrual Hygiene Day. So thank you so much for that. So we're now going to move on to our next speaker, who is Mr. Skerritt, and he's the Adolescent Development Specialist at UNICEF Office for the Eastern Caribbean area. And he's going to talk to us about some regional perspectives on menstrual health, education, and hygiene, and how we're trying to solve the stigma and challenges around these issues in the region. So over to you, Mr. Skerritt.
All right, I'm just going to say good morning to everyone. And then, as always, in the region, we may have bandwidth issues. So I'm going to turn off my camera. But I'm happy to see so many people online. So, again, my name is Liston Skerritt. I'm the Adolescent Development Specialist. But interestingly enough, I am also the gender focal point for the UNICEF Eastern Caribbean office. That very clear intersection tells you how I work in this space of gender equity and equality, and particularly the thrust that UNICEF has towards supporting adolescent girls, their access to education and healthy opportunities. So I bring you greetings on the behalf of our representative, Peter Bolt, and I am truly happy to be a part of an organization that is committed to ensuring all menstruating persons manage their cycle in a dignified and healthy way. Let's see if we could get these slides. Okay, so for UNICEF, it's actually kind of complex, our Caribbean approach. I think Ina scratching her head because for the Caribbean, we actually have 7 different UNICEF offices who try to address the needs of children, adolescents, and youth throughout the region. And so depending on where you're on the call from or what country, you may either be within the Eastern Caribbean district, which is the Leeward Islands, Windward Islands, Trinidad, and Barbados. So you may be from one of our larger offices in Jamaica, Cuba, Haiti, Dominican Republic, or Guyana, Suriname, or even Belize is there as well, right? And so we have a regional framework that really outlines how we support adolescent girls within the region, and it's assessed, as kind of mentioned by Ina there, through our gender focal lens. So as an organization, we're committed through our gender action plan to make sure we're collecting effective and informative data and evidence. We look at strategic partnerships like the ones on this call today. We look at how we mobilize resources, which is a little different than many of the other agencies, but I think particularly UNICEF, UN Women, UNFPA, and UNESCO have strategic partnerships where we mobilize funds, technical assistance, and capacity development. And so, though I'm presenting on behalf of UNICEF, we are one UN family, and we actively work in this space to make sure that young ladies have the best opportunities available to them. We look at building capacity. So we have several training opportunities even within the organization. We look at diversity and gender parity within our roles. And then, of course, we also pay attention to our accountability. So we're excited for this year, because that 10-year celebration is also a celebration for us as UNICEF. We've, I think, been actively a support of this program from the very beginning over the years. Our frameworks and policies have evolved to be more engaging around Menstrual Health Day. And there's one particular, and I know this comes from last year's slide deck, but I think we're particularly committed to educating everyone about menstruation. And you'll hear a little bit about the project in St. Kitts and Nevis, but I think that's really important to us. I think what we're realizing in the region, and to bring it to that context, is that grassroots movements, NGOs, community organizations, uniform bodies are the ones who are leading on some of this cultural transformation and addressing the issues of stigma. And so we try to find spaces in which we can support these organizations to move forward and work collaboratively. But let's talk about the stigma a little bit, particular to the Caribbean. I think one of our challenges is often most of the organizations we're grouped as Latin America and the Caribbean. And a lot of times the data from Latin America outweighs the available data from the Caribbean. So one of our challenges when it comes to stigma is a lack of definitive data. I did do a bit of an empirical review, and you found some small studies in the Dominican Republic. Most of them are master's students, sometimes working with a health department or a gender bureau, but we're lacking a very comprehensive look. And that's something I think UNICEF would be interested in working with partners on really understanding what does period poverty mean in the Caribbean, Do we have these challenges? And a lot of times, because many of our countries are categorized as middle income or lower upper income, it's assumed that we don't have some of the same challenges, but from some of the preliminary data, I can tell you we do. We're also looking at challenges around stigma when it comes to awareness and education. That is for persons who are menstruating and whether they have sufficient information to prepare them to go through the process. And I think that's been talked about a little bit as well. But that education cannot just be for the individual, but also for the household. And sometimes just the generational differences and how things were done previously, there tends to be a little bit of a disconnect there. One of the things that came out of COVID, we saw with the impact of menstrual education on their basic education or lack thereof. Uh, you had additional lost days of school, and that's something we want to pay close attention to. Again, forming the umbrella of stigma, access to menstrual products. And just from my time working in the United States, sometimes it's a lot easier there because you saw donations or contributions many times to schools and universities. That's something that often, because of our geographical location, we don't get access to. Healthy and safe sanitation and hygiene facilities. Um, though many of our schools are up to date, sometimes they don't have secure spaces where young ladies feel comfortable to go. And so this is, I think, is also something that needs to be assessed. I think participation in activities, and this particularly for the region, comes down to engagement in sports. And when you look at the recent research around women in sports, and one of the reasons that have been at least anecdotally shared for lack of engagement is uh, improper menstrual hygiene options and services and so forth. And then finally, the one that recently came out, again, exacerbated by COVID, but we also saw it in the example with what was happening in St. Vincent, was the impact of access when it comes to disasters and emergencies. And just because of the vulnerability of the Caribbean, it's something we need to pay close attention to. All of these areas, I would say, when we look at the regional context, need to be studied. And while there is some minimal secondary data, we do need to do some further study to really understand the context that is going on in the Caribbean. Now, one of the trends, and I think this is just a high point that I want to highlight, is just kind of some of the options that you're seeing happening in the Caribbean. Because of some great individuals like Abby, um, you're seeing projects in different islands from CSOs, NGOs, and community organizations. And so I just wanted to highlight the work that they are doing there, as well as a similar program happening in Antigua called Pass the Pad. UNESCO, and I talked about access to resources. UNESCO has a great program in partnership with PNG that they look to provide resources and services to schools. And then we also saw within St. Vincent some work done with USAID. And so often development partners are involved, and I would say at the activity level, often trying to respond to requests from gender departments or bureaus or ministries of education. But I think one of the things we need to look at is more comprehensive approaches, which I'll talk about in a minute. And then the World Bank has also been very active in the region, I think, with a variety of what we call WASH projects, which is water, sanitation, and hygiene, and often trying to include menstrual health or menstrual hygiene education within their programs. So what are the key interventions that we need to look at in the region? First, I think we need to look at policy and programmatic interventions. Some of these are happening in more of a country by country or ad hoc manner. But it would be good to see if we could have comprehensive programs across the region, trying to make intervention, educating teachers, youth leaders, guidance counselors, as well as incorporating it into whether it's some countries call it HFLE or PMSE. It's basically the health science education curriculum. That would be ideal. Community education and support, I think, in the Caribbean is very important. We know this is often the root of support outside of the household. The adage that it takes a village is still very prominent in the region. And I think that is something where we have to look at what spaces and areas our young people engage, whether they are children or adolescents, and being able to support them with educating the adults and individuals around them. And then finally, I think improving access to products and facilities, trying to look at the cost inflation that has happened in the region. I know some countries have gone as far as to remove import or consumption tax. This is a very supportive model, and we hope to see others through advocacy, internal and external, make these kind of ventures. So thank you for listening. I think that was my slide.
Wonderful. Thank you so much, Mr. Skerritt, for your presentation, and very bang smack on time, 10 minutes. Thank you so much for your presentation. We really appreciate it. And it's great to hear about all the work that's going on across the region, and also to hear your thoughts around what needs to be done in terms of policy and interventions. So now I am going to introduce myself. So I am going to give a short presentation on what we're doing locally here in St. Kitts and Nevis around menstrual health education. So, so let me just get my slides up here. Okay, great. So everybody can see my slides, I hope. All right, great. So my name is Abby Bejo. So let me introduce myself properly. So I'm the program director at Lake Health and Wellbeing. And we're a public health NGO based in St. Kitts and Nevis, and we're a registered NGO. Our charitable aim is to improve the health and well-being of our local, regional, and online communities. And generally speaking, we focus mostly on non-communicable diseases because that is the major public health challenge facing St. Kitts and Nevis, but also the region. But obviously, we have delved into menstrual health because we do feel it's also related, because persons would have chronic reproductive conditions that are also considered NCDs. So our approach to tackling the public health challenges, just to give you a bit of more background about ourselves, is that we do research to identify gaps and understand health needs. We advocate for evidence-based health policies and interventions, and we carry out health education events like this to empower the public to make informed choices about their health. We also implement public health interventions like our menstrual health education project. And these are to address gaps, provide support, and to bring about change. And then we also offer consultancy services to support organizations in achieving their health, wellness, and well-being objectives. So when we think about menstrual health education, our first journey into menstrual health in St. Kitts and Nevis was with our Fibroids project. So we carried out this project in about 2020, and we interviewed women really who were living with fibroids about their experiences. And as you may know, fibroids really disrupts women's menstrual health. And from that project, we learned a lot about the impact that menstrual illness, or the impact that a disrupted menstrual cycle can have on women's health overall. So we realized that if your menstrual health is disrupted, it affects your physical health, obviously, because you're going through severe pain, menstrual bleeding, anemia, all of these things. Also, it affects your personal and social life. So if you can imagine you're having this constant pain, heavy menstrual bleeding, it disrupts your daily life, it affects your relationships, it also affects your professional life. You know, it's very hard for you to engage in work if you're going through all of these symptoms, and these symptoms are chronic. So it can lead to absences from work, low productivity, tension in the workplace, job losses, bleeding accidents, which can be very embarrassing. And then it sort of adds to that kind of stigma. Finances, you know, if you're having really a disrupted menstrual cycle, you're having these symptoms because you might have an underlying issue like fibroids or endometriosis, it can become quite costly. There's the cost of care, there's the medication, which adds up, the cost of pads, which adds up. And then, of course, when you're going through all of this, it significantly affects your mental health. So women expressed that, you know, they had a lot of anxiety and fear and distress and stress around their menstrual health because of it being disrupted. And then when you think about you're going through all of this and you're trying to then achieve good health and well-being, that can be very difficult. And so there are a number of barriers that we identified in terms of achieving good menstrual health and well-being. So we've talked about the stigma and embarrassment, which means that when women have issues with their periods, they're very uncomfortable with discussing these issues. They're very uncomfortable with reaching out and speaking out. And therefore, it's very unlikely that people are going to seek help if they're feeling embarrassed about a particular situation. We also found through our research project a lack of accurate, culturally relevant information, which means that women really don't have the information about what really should a normal period look and feel like? What is my menstrual cycle? So all of those important issues and information that you probably need to make an informed decision about your menstrual health. There was just general lack of awareness across the board in terms of menstrual health issues. So whether that be lack of awareness amongst boys, girls, men, women, there was just a general lack of awareness around menstrual health issues, a lack of empathy. We found the society become very unkind when women are having menstrual health issues, particularly in the workplace. There was a lot of lack of compassion, a lack of understanding, a lack of sort of willingness to sort of accommodate women who might be having issues with their menstrual health and working. And then, of course, a lot of health system gaps and insensitivities, which really compound a lot of issues. Because if you can think about if doctors are insensitive, if other healthcare professionals are insensitive, then that creates a barrier and women are not willing to access health. So all of that, the impact of all of that is that women were feeling disempowered, isolated, and then silently battling through painful and uncomfortable menstrual symptoms. And some women battling these symptoms for years and years and years on their own. So we really felt that we needed to do something about this. And so what we wanted to do was to start with the younger generation. We wanted to initiate change by targeting the next generation. And so we were able to collaborate with WASH United. So thank you so much, Ina and her team. So we collaborated with WASH United because they have a range of different resources, which I will kind of quickly tell you a little bit about. And so what we wanted to do was to educate, empower, and engage girls and boys about menstruation to promote good menstrual health and well-being. And as well as tackling the stigma and all of that, that through this menstrual health education project, we also wanted to create a greater awareness so that girls and women can take prompt action when they have abnormal symptoms, so that they don't have to live with these types of symptoms for years and years and years, not realizing that maybe they do have an underlying issue like fibroids, endometriosis, or some other condition like PCOS. So we really wanted to create that level of awareness and empowerment. So just to say, this project is a partnership with WASH United and also the Advancement of Children Foundation, who have very kindly provided us with a grant to do this work. So we're very grateful to them. Other collaborators are the Department of Gender Affairs in Nevis and the Ministry of Education, obviously, who've allowed us to go into schools to educate girls and boys. So what we've been using is WASH United's resource. So WASH United have a menstrual health education guide, and they've developed it for different regions in the world. So they have a guide for Africa, which is called Rosie's World, and a guide for Asia, which is called Ruby's World. And so we worked with WASH United to adapt that guide for our local context. And so we have a guide that we're calling Charista's World. And then we also developed something called Jaden's World to test out menstrual health education with boys. And so what we did was we recruited, and then WASH United trained us and our menstrual health educators to deliver 60 to 90-minute workshops for girls and boys. And these workshops are very engaging. And it's really menstrual health education through a storytelling approach. So a very creative and engaging approach. So just to quickly tell you in terms of the progress so far, so we're really very happy with the progress. We've reached over 500 children in St. Kitts and Nevis. And we've been able to do that by targeting schools, churches, and summer camps. And at this point, I'd just like to say a big thank you to the Ministry of Education that we were able to engage with the guidance counselors and have a really good session with them in St. Kitts. And then through that, we were able to then have sessions with a lot of schools. And as you can see, our lovely menstrual health educators doing a great job getting out into schools to educate girls and boys. And you can see there are lots of smiling faces. So they're enjoying the sessions, they're engaging, asking questions as well, which has been really great. Just to show you a few more pictures, just to give you a flavor of really what's going on. We've done loads of different sessions, outside, inside, at schools and community centers, everywhere that we could, really to just try and reach children where they are. And I love this picture here of one of our menstrual health educators hugging a young lady. Again, that's showing really we're creating an environment where girls can feel comfortable enough to speak about their menstrual health and ask the questions that they need to ask. We also were able to engage, I'm not sure if we have the picture here, but we've also been able to engage with children living with disabilities through a camp that was aimed at children with disabilities, and also through a school that works with children with disabilities. So as much as possible, we are trying to be inclusive with this project. So just to give you a bit of a flavor of the impact so far, So when it comes to knowledge, what we've been doing is that we've been giving kids a feedback form to complete at the end of the sessions. And so, about 100 and something of them have completed the feedback form. And so when we think about knowledge and the impact that has had on young people's knowledge, we look at various different topics around menstrual health. And the blue and the red are where we're looking at. So the blue is where kids have said they know a lot more now because of our sessions. The red is where they know a little bit more. And so we're seeing that we're improving knowledge around particular issues, around puberty, around the menstrual cycle, around what period products you can use, around how you can support each other, and then how to track your periods. We're very happy that the project is improving knowledge. When we look at the emotional impact that the project is having, what we are able to say is that because of the training, girls are now feeling a lot more positive about starting their period. And I think the blue is how they're feeling is great now that they've had this session, the period won't stop me. And then they're feeling quite good is the red. And so that's about 60-something%, if my math is right, 60-something%. So the vast majority of girls after the session are feeling more positive about their periods. But we do still have a significant sort of minority here. They're feeling a bit worried, and that's just indicative of the fact that we probably need to do some more follow-up and just to make sure that girls are feeling comfortable. So just to give you an idea of what the girls themselves said from their own words and the general impact of the project so far. So here, a young lady is saying, it helped me to understand how to deal with my period. So again, it's creating that understanding and empowering girls to understand how to manage their period. One of the girls says, it shows us our sisterhood. And again, that is showing that, you're not alone. We are all in this together, we can support each other. And then someone has said being able to talk about it with comfort and trust. So again, we're creating an environment where girls feel comfortable enough to talk about their periods and talk about the concerns that they may have. One girl here said, it is helpful. So when I get my period, I'm ready. And I think that's really powerful because sometimes, I know when I started my period, I was not ready. I was a bit shocked. So I think it's nice to be able to make sure that girls are ready, they're prepared, they know what to expect in terms of their periods. A young lady here said, now I feel better and relaxed, which is nice because, sometimes it can be very scary when you're thinking about your period and about to start your period. And so for her to be feeling a little bit more relaxed and feeling better about it, really for us is a nice positive thing. This one is interesting because I think it really shows that we need to ensure that we give young people a space and a way to express themselves. And because the workshops are quite interactive and they use different tools to get students expressing themselves, this young lady said she liked the song, she liked the dance because it helps me express myself. So verbally, she may not have been able to express herself and say what she was feeling, but through song and through the dance, she was able to express herself. So this means that we're giving girls the opportunity in whatever way they feel comfortable to express themselves. So just some observations from our mental health educators. I hope they don't mind. I kind of stole a few quotes from them in WhatsApp chat. So just a few sort of insights and observations. So one of the mental health educators said, there was a beautiful moment when the older women came in, sat with us and shared their experiences. And that's really showing like a nice intergenerational sharing of information, which doesn't really happen a lot of the time. So we're providing that sort of platform for that to happen. Again, an observation that, the young ladies felt more comfortable talking about their periods after the session. They left informed and inspired to support each other. And then just to show that, the girls do have a lot of questions. And if you don't provide that space, who are they going to ask? So, they asked a lot of questions. They were very engaged. And most were well informed because the counselor was on the topic of puberty, which is great. So we're aligning with what's happening in the school system. And then she mentioned that the principal joined us for a few minutes and she's very supportive. And of course, that's very important, having the Ministry of Education support in terms of a project like this. So I haven't put it here, but also the boys are very interesting because I think for the boys, these sessions are like a complete awakening. They don't realize what women are going through. They don't realize that actually we menstruate every month. They don't realize the pain. They don't realize a lot of things. So it's like an awakening for them. And really, they are now more open, which I'm going to come to, a bit more open to really being more supportive and empathetic because they're now getting a better understanding of what girls go through every month, which is great. So in conclusion, the project has been very well received. Girls and boys have gained knowledge about menstruation, Girls feel more comfortable, more confident, more prepared. Girls know how best to support each other. But the boys are very interesting. They've developed a sense of compassion because they didn't really get what it is that girls are going through during their periods. They have a better appreciation of what women and girls are experiencing, and they have a willingness to be supportive. One of the conversations that menstrual health educators have with boys is, how could you support your girlfriends? How could you support your sister, your mother during their period? And so they're given the opportunity to think about these types of things and discuss them and ask questions, which I think is really great. So just to finish up with some acknowledgements, I would like to thank WASH United for partnering with us on this project, for all the great support they've given us, for the permission to use their resource and adapt it. We would love to thank the Advancement of Children Foundation for their wonderful support. Obviously, without them, we wouldn't be able to have implemented this project. So we're very, very grateful, and we'd just like to say thank you so much. We'd like to thank Michelle Sutton. She was formerly the Health and Wellness Coordinator at the Curriculum Development Unit at the Ministry of Education. And she worked closely with us in terms of adapting the guide to suit the context of St. Kitts and Nevis. I'd like to thank our mental health educators and volunteers, and then the whole Ministry of Education kind of system, because obviously without the Ministry of Education, we wouldn't be able to get into schools. Very appreciative to the guidance counselor coordinator, I had a great meeting with her. I was then able to go and give a presentation to all the guidance counselors. They were then able to invite us over to their schools to give presentations. So really, really great. And of course, the principals. I mean, we can't do this without the approval of the principals. So we'd like to say thank you as well. I'd like to thank all the churches, the summer camps as well, for embracing us and inviting us to attend, and also being willing to accept our requests to bombard their summer camps. So we appreciate that. And of course, all the lovely young people who have attended all the sessions. They have been so wonderful. They've asked great questions. They've been very engaged. So we really do appreciate them as well. And I think that's it. So thank you, everybody, for your attention. And obviously, if you have any questions, you can put them in the chat. We'll get to that during the Q&A. So that is it. So thank you so much. And now I am going to hand over very quickly to Saras Hendrickson, who's the Interim Director of the Department of Gender Affairs in Nevis. And she's going to talk to us a little bit about sort of like a government perspective. So over to you, Saras.
Thank you, Abby.
You're welcome.
Thank you so much. Thank you. All right. Good morning, everyone. Share my screen. Okay. Okay. So I am Ms. Saras Hendrickson. I am the Interim Director here at the Department of Gender Affairs Nevis. My background is in sociology and gender development studies. I'm also in menstrual health education with Lake Health Wellbeing and WASH United. So I'm going to give us a little insight onto what we're looking at here at government level. But before I do that, let me offer you some capture of what I've done so far for the past 10 months. I've been to 6 schools, 2 secondary and 4 primary schools here on Nevis, 2 summer camps. So far, I've done 132 girls that range from ages 8 to 13, and recently 17 boys that range from age 12 to 14. So what I've captured is a number of things, and these are my observations here. Hold on. Okay, one moment. All right, so when it comes to the stigma and the misinformation around mental health issues, these are some things that I would have noticed. And this would have come from the conversations I've had with the girls and boys and also the guidance counselors. I noticed that there is a silence and a shame when you're mentioning the word period. From the moment I step into these classrooms and I ask them, what is a period? They shy away, or they would not speak, or they would tighten their lips. And their response would be euphemisms like, oh, it's Aunt Flu, or it's Shark Week, or Santa Claus is coming. So there is this discomfort when they're speaking about or mentioning the word period. I also realized too that there is this social cultural norm that is reinforced when it comes to the stigma around all menstruation. because of the use of these euphemisms, they tend to conceal what a period is, or that they're actually menstruating. And that would let me know that, okay, this is a shameful topic for them to speak about. And they think that this is private matter that should be hidden. And we know that when that happens, it means that one, they would be open to misinformation. And two, if you're uncomfortable with speaking about, this natural process, it means that you will not be able to learn about it as well as you should. Some girls, they are uncomfortable with speaking about their periods, and there are other girls who were vocal about it, which was very good. In my first sessions, especially at the primary school, the girls were a bit shy, but after 1 or 2 sessions after, they open up and they're able to ask the right questions, and they're able to speak about the experience, and they become more comfortable with speaking about that. So there is also misinformation on how the menstruation cycle works. This could be because one, like I said, is not something that is spoken about at home, or if it is, they would not be privy to the biological process. And I think also at that level, especially in primary school, they're not going to teach them the process of the menstrual cycle. And also from forms 1 and 2 at the high school, they perhaps will not teach them that also. So of course, through the sessions that they would have with me, I'll use the opportunity to show them how that process works. And then when they see that, along with the diagrams, they're able to ask these questions. And like Abby said, there is this awakening to this magnificent thing that's happening to their body, right? They're also unaware of the location and the function of the reproductive organ. They don't understand that there's a lot of things that's happening inside their bodies when it comes to the menstrual process. And when I show them the diagrams and explain how this process works, they are in amazement. And then the more questions come. With the boys, they are curious to know why girls are menstruators and why they're not menstruators. And when I would share to them, yes, this happens every month to a healthy female, they were shocked that this happened. And on their faces, you could see this concern and this curiosity as to, how is it that these females are bleeding every month? And this would give me the perfect opportunity to engage them in this discussion, this dialogue, to teach them about how this process works. Not many people are aware that there are reusable menstrual products. I did a health fair in April, and I used the opportunity to display some reusable menstrual products that we have there, and also some disposable menstrual products. With the reusable products, adults and children, they were amazed that these things existed. So I realized that this is also an opening where more education is needed to engage the public and also the schools when it comes to these products that are available. Girls are uncomfortable speaking about their periods with their dads. They think that, one, something that I don't speak about, or two, if I do speak about it, I have to have that conversation with my mom. Next, this is a problem that is persistent, where there is an improper disposal of the used menstrual products, the pads in particular. In the primary schools and the high schools, the complaint from the guidance counselors and principals is that, these girls, they tend to not dispose of these items properly. So I'd find that within my sessions, I have to reiterate and encourage them to use the proper way of disposing these items. And not everyone can afford menstrual products. The cheapest here that I've seen is for $11.95 EC dollars. And that in itself is a challenge for certain families, especially those of the lower income bracket. They are unable to purchase sanitary pads monthly, worse yet, in bulk. Next, what it is that the department can do to break the stigma, and what are the policy perspective we have. So this is what we are focusing on, and we believe in education, and with education, it has to be realistic. It has to answer to the context of here and St. Kitts and Nevis. It must be impactful. doesn't make sense to have, these educational sessions and we're not reaching the people who we ought to reach, and it has to be transformative. So at the end of these sessions, these young girls and these boys, they should have a clear understanding of, one, how the female body works, and two, an appreciation of how that body works, and three, a goal to break the stigma and kind of think more positively when it comes to a woman who is menstruating, especially with the boys, for them to engage in empathy with their moms, their aunts, and their female counterparts. So I believe that there should be more online conversations with our collaborators through podcasts, through panel discussions, through webinars like this one. We're reaching out to the global community. I also believe that there should be an applied learning via continued engagements in the schools. So we should continue to go out there and educate not just the students, but also their parents, the guidance counselors through training, and also the male counterparts. We cannot do this in a silo with just females. The males also must be engaged within this education drive. We're working on also, we would have received donations in a couple of months, and I'm expecting some soon, donations for menstrual products from our partners, particularly those in Texas and in New York. They would send barrels of reusable pads and tampons and other menstrual products and pads. We would take these and we would distribute these to the maternity ward here at Alexandria Hospital, and also to social services, to their teen moms. And also we'll go to the schools and give out a few to certain students who are in need. This is something that must be sustained, I believe. So we would need more collaborators to come in and to donate. We have to ensure that our girls receive adequate sanitary protection and advice on coping with their periods. It has to be constant. I agree with Abby that there should be follow-up with those girls who we would have had sessions with, to ensure that, they continue to feel comfortable with their periods. And if they may have new questions that we may have missed, then I would make sure that they have the opportunity to ask those questions, and to encourage organizations to support period equity in their institutions, where perhaps they can have menstrual pads dispensers in their offices, in their bathroom, ensure that they are aware of the challenges that menstruating women face within their offices and also in the schools. So there can be a great degree of empathy when dealing with these women, and understanding that, we first lead with care and understanding with what these women are experiencing. When it comes to the policy perspective, of course, it has to be evidence-based. And I must say, Lake Health Wellbeing is doing an excellent job with that. And I firmly believe that, and also the government firmly believe that, it is important to have policies that are sustainable. It's not just for this year, it has to ensure that there's longevity when it comes to these policies. So every single group is protected and represented. It has to be adaptable, and it has to belong to all menstruating persons, which means that whatever policies that we're drafting, they have to be a part of that draft. They have to be a part of that discussion. And of course, they are part of the numbers that we get from the statistics. The technical administrators also of the policies, they are the ones who draft these policies, who make sure that these mandates are carried out well. Now, these policies, they must promote menstrual health, and they must address menstrual inequality. The reason being, because we have to ensure that they foster a society that embraces menstrual hygiene. And this is definitely a natural. I don't think most people understand. I think they say that because it's a natural path of a woman to menstruate, then she should just get over it. But it's more than that. Yes, it is a natural process. And yes, there are complications with it. And we need a society that understands that, and not conceal that pain or conceal that experience. I firmly believe that when it comes to the policy perspective, there are two things that we're looking at. One, a continued and a comprehensive menstrual health management education program, like the one that we're working on here on Lake Health Wellbeing, comprehensive, that it covers destigmatization, covers breaking the taboos, it covers having respect for the language we use around menstruation and the experience of a menstruating woman. And this should ensure that even when you have generations coming up, it stands and it grows with the challenges and the changes that would occur over the time. There should also be policy on the distribution of free menstrual products. It's very important, at least in the schools per se, because you do have young girls who are unable, like I said previously, who are unable to buy menstrual products. These girls are particularly a part of the low-income groups. There should be free menstrual products in public spaces, schools, and shelters, particularly shelters. Worst case scenario, if there happens to be an earthquake, if there happens to be a hurricane that passes through here, we do have shelters around the islands of St. Kitts and Nevis. I am not sure if they're outfitted with pad dispensers, or I'm not sure if they're outfitted with dignity kits for menstruating women at those times. So the last thing we would need is, if an event like that happens, we don't have the facilities and we don't have the products there to ensure that they're able to be in a space where the dignity can be kept intact. And that's where we are here with that, with the policy and the observations that I saw here on Nevis. If there are any questions, please post them in the chat, and thank you.
Well, thank you so much. That was really a really informative presentation. Thank you so much, Ms. Hendrickson, for that.
You're welcome.
Policy perspective, and then also her observation out in the field. So wonderful, wonderful, wonderful. So now we have time for some questions. So if anybody has any questions, you can pose them to any of the speakers, and I'm sure they'll be very happy to answer. There is a question for Kimberly, which I think is probably for Mr. Skerritt. So that question is, what current efforts, if any, are being made to collect empirical data on menstruation disparities, period poverty, and menstrual health in the Caribbean?
Thank you. I thought that, and then our electricity went, so I had to switch to a phone device. So thanks for bringing it back up. There is a preliminary conversation happening between several organizations right now about mobilizing funds to have a full study. Part of the challenge often, though, is dealing with multiple countries. And so sometimes the selection of the participating countries ends up being simply which ones are more responsive, or if you have a good focal point. But I can tell you that there is a conversation around that right now, and hoping to do at least 10 of the Caribbean countries based on level of interest, whether it's going to be the Gender Bureau or Ministries of Social Transformation. We're working through that right now, but several development partners and non-profits, NGOs have expressed an interest. So we're starting that preliminary conversation.
Wonderful. That's great to hear. Thank you so much. So Kimberly, did that answer your question, or do you have any follow-up or anything?
No, that answers my question for sure. Thank you, Abby.
Okay, wonderful. Does anybody else have any questions? Feel free to put your question in the chat, or you can unmute yourself and you can ask your question. Feel free. We have a very quiet audience, but feel free, everyone, to ask any questions that you may have. You may not get this opportunity again to have lovely Ina, Mr. Skerritt. So please, and also Ms. Hendrickson. So please, if you have any questions, feel free to ask. So Kimberly has another question. Over to you, Kimberly.
This question is for Ina, and coincidentally with Menstrual Hygiene Day, I have not heard of it prior to researching this topic on my own, with wanting to address this in the region. But I wonder, and I'm asking this, I guess, for a collective with the U.S. Audience, is I've not heard this, and I was a former classroom teacher in our classrooms here in the States, and I don't know if efforts have been made through the states, and we're in Illinois, a very progressive state. So I don't know if this organization or has reached out to different schools here or public schools here.
Thanks, Kimberly. So Menstrual Hygiene Day is a platform, right? So everybody can engage. But we do have really strong partners in America, like period.org, who are mostly working with university students. Unfortunately, May is also university holiday time. So that they have a menstrual month of May. plus a local awareness day in September. There's also the Alliance of Period Supplies, which is an alliance of registered NGOs and charities. They address period poverty, and they also coordinate a network. Both organizations are really strong in advocacy with local decision makers, like, as you said, Illinois is very advanced, Florida is the latest example. So it is not us who do the advocacy, but it is those organizations in the states, either networks or even on the ground. We have a very strong parliamentarian, Grace Meng, who always is in New York, putting in menstrual equity policies and legislation into the parliament. So it is, I know that in Illinois, there are quite a number of organizations. Bringing it into the curriculum and in events is really then up to ongoing advocacy and so on. So I'll type in the 2 links to the organizations in the chat box, and I really recommend reaching out, depending on which level you want to engage in, which organizations, but these are really, really well networked, strong organizations.
Wonderful. Thank you for that. Any other questions? Any comments, thoughts on what you've heard today? Anything at all that anybody would like to share? No questions. Nothing for Mr. Scarrett. Nothing for Ms. Hendrickson. Nothing for Ina. No questions at all? Okay. All right. Well, I guess if there are no questions, I mean, if you have questions, maybe you can't speak right now, or you're unable to type right now. If you do have questions, you can always email us your question, and then we'll put it to one of the speakers. Ina's put in a link in the chat. So, I mean, for Kimberly, but also everybody else can also access that link. So I guess if there are no questions, then we'll just go over to Kimberly to just give us some closing remarks and to wrap us up.
Thank you, Abby. Our discussion here has been both illuminating and inspiring for me, hearing everyone speak. And I loved how we are shedding light on this challenging topic. And we're finally, I think, trying to address this for our next generation. And we're showing that period stigma affects people worldwide. I want to thank all of you for joining us today for this webinar. And as we know, period stigma is not merely a matter of inconvenience or discomfort. It's an injustice, and an injustice in a way where we're depriving individuals of knowledge, dignity, and autonomy. But amidst the challenges of period stigma, we've also heard glimmers of hope from all the stories that I've heard: resilience, educational programs, and collective action. Change is certainly on the horizon. And as we reflect on our discussion today, let us carry forward the momentum generated by this webinar. Let us be the agents for change in our communities, challenging outdated beliefs and fostering open dialogue and advocating for policies that promote menstrual health. Let us be the voices for those who are silenced and or shamed by period stigma. And I'm wishing all of you a happy Menstrual Hygiene Day. But I'd like to end with what Ms. Saros mentioned, and she said that everyone has to be included. And I think that that's one of the key things that I take away from here, that although we want to be the agents of change, we have to bring everyone, even those that menstruate, those that don't, to the table for these discussions. Thank you again, and take care.